Now, this past summer, we kicked off a series of regionally focused conversations so that we could better understand and more effectively address the unique challenges being faced in different parts of our nation. So far, Secretary Sebelius and I have taken our roadshow to Miami, Los Angeles, New York, and Boston, and we plan to visit additional cities in the coming months. Like Detroit, these locations have become hotspots for healthcare fraud schemes. Here and across America, these crimes are driving up healthcare costs for everyone and also hurting the long-term solvency of our essential Medicare and Medicaid programs. But together, we are fighting back in bold, innovative, and well-coordinated ways. And our Healthcare Fraud Prevention and Enforcement Action Team, known as HEAT, is an essential part of this work. Now, since launching HEAT in May of 2009, the Departments of Justice and Health and Human Services have broken down barriers to communication and collaboration. And by leveraging resources and sharing information and sharing expertise like never before. And we brought law enforcement partners together at every level into this work. Now, together, we have ensured that our nation's fight against criminal and civil healthcare fraud is a cabinet-level priority within the Obama administration. And we have strengthened the capacity and the record of success of our Medicare strike forces. Now, as we have seen in recent months, this approach is working. We are starting to see the result of that work. In just the last fiscal year, we obtained settlements and judgments amounting to more than $2.5 billion in False Claims Act matters alleging health care fraud. That's $2.5 billion, the largest annual figure in history and an increase of more than 50% from fiscal year 2009. We also opened more than 2,000 new criminal and civil health care fraud investigations, reached an all-time high in the number of health care fraud defendants who were charged, stopped numerous large-scale fraud schemes in their tracks, and returned more than $2.5 billion to the Medicare Trust Fund and more than $800 million to cash-strapped state Medicaid programs. Now, here in Detroit, the work of this area's Medicare strike force has resulted in charges against 120 defendants in 18 separate criminal cases for fraud schemes totaling nearly $120 million in taxpayer money. So far, 8 of these individuals have been convicted and 63 have pled guilty. Last August, a physician from Farmington Hills was ordered to pay more than $9 million in restitution and sentenced to 14 years in prison for his role in a brazen scheme to bribe Medicare beneficiaries and to bill the government millions of dollars for therapies that were never, ever provided. In December, the president and vice president of a therapy center in Livonia were sent to prison for similar crimes. And just a week and a half ago, the owners and operators of a Detroit area clinic were sentenced to running a scheme involving fraudulent billings and money laundering. In an attempt to avoid scrutiny, these individuals had relocated their operations from Miami, but thanks to the excellent work of our Detroit strike force, they were identified, they were stopped, and they are being brought to justice.
The main message is that we are focusing in a way that is historic on cracking down on fraud. We have a commitment made to seniors in this country and disabled Americans for Medicare to protect those trust funds. We also have Medicaid who's serving millions of people across this country, and that we want to send a very strong signal this is not a good place to look to for criminal activity, that laws are getting tougher, prosecutions are much more vigorous, the data system is getting better, and we are really going to hopefully not only prevent fraud in the first place, but if you commit fraud, we're going to come after you.